COVID catastrophe could have been prevented. Independent global panel. The Independent Panel for Pandemic Preparedness and Response said a series of bad decisions meant COVID 19 went on to kill at least 3.3 million people so far and devastate the global economy. The catastrophic scale of the COVID 19 pandemic could have been prevented, an independent global panel concluded Wednesday, but a toxic cocktail of dithering and poor coordination meant the warning signs went unheeded. The Independent Panel for Pandemic Preparedness and Response said a series of bad decisions meant COVID 19 went on to kill 3.3 million people so far and devastate the global economy. Institutions failed to protect people and science denying leaders eroded public trust in health interventions, the IPPR said in its long awaited final report. Early response to the outbreak detected in Wuhan, China in December 2019 lacked urgency, with February 2020 a closely lost month as countries failed to hit the alarm, said the panel. To tackle the current pandemic, it called on the richest countries to donate a billion vaccine doses to the poorest. And the panel also called on the world's wealthiest nations to fund new organizations dedicated to preparing the next pandemic. Delay, hesitation and denial. The report was requested by World Health Organization member state last May. The panel was jointly chaired by former New Zealand Prime Minister Helen Clark and former Liberian President Ellen Johnson Sirleaf, a 2011 Peace Prize laureate. The report COVID-19 Make It the Last Pandemic argued that the global alarm system needed overhauling to prevent a similar catastrophe. The situation we find ourselves in today could have been prevented, Sirleaf told reporters. It is due to a myriad of failures, gaps and delays in preparedness and response. The report said the emergence of COVID-19 was characterized by a mixture of some early and rapid action, but also by delay, hesitation and denial. Poor strategic choices, unwillingness to tackle inequalities, and uncoordinated system created a toxic cocktail which allowed the pandemic to turn into a catastrophic human crisis. The threat of a pandemic had been overlooked and countries were woefully unprepared to deal with one, the report found. Vaccine ultimatum. The panel did not spare the WHO, saying it could have declared the situation of a public health emergency of international concern, its highest level of alarm, on January 22, 2020. Instead, it waited 8 more days before doing so. Nevertheless, given countries' relative inaction, we might still have ended up in the same place, said Clark. It was only in March, after the WHO described it as a pandemic, a term that is not officially part of the alert system, that countries were jolted into action. As for the initial outbreak, there were clearly delays in China, but there were delays everywhere, she added. Without the lag between the first identification in Wuhan and the PHEIC declaration and then the last month of February 2020, we believe we wouldn't be looking at an accelerating pandemic as we have for the last 15 to 16 months or so. As simple as that, said Clark. The panel made several recommendations on how to address the current pandemic. Rich, well-vaccinated countries should provide the 92 poorest territories in the COVAX scheme with at least 1 billion vaccine doses by September 1 and more than 2 billion by mid-2022. The G7 industrialized nations should pay 60% of the 19 billion required to fund vaccines, diagnostic and therapeutics via the WHO's Access to COVID Tools Accelerator program in 2021. Fellow G20 nations and others should provide the rest. The WHO and the World Trade Organization should also get major vaccine producing countries and manufacturers to agree voluntary licensing and technology transfers for COVID-19 vaccine. If actions do not occur within the 3 months, a waiver of intellectual property rights should come into force immediately. Invest billions, save trillions. To tackle future outbreaks and the pandemic, the panel called for a global health threat council made up of world leaders plus a pandemic convention. The G20 also create an international pandemic financing facility able to spend 5 to 10 billion a year on preparedness, with 10 to 100 billion ready to roll in the event of a crisis. Ultimately, investing billions in preparedness now will save trillions in the future, as the current pandemic has so clearly illustrated, Clark told reporters. The panel also proposed an overhaul of the WHO to give it greater control over its funding and more authority for its leadership.